Well, I'm sure there's several factors here. Number one, most people think of vitamin C as it's a vitamin, and you define vitamin as a trace amount of a substance that you need to prevent scurvy, for instance, in vitamin C's sake. But what we're talking about here is something in a pharmacologic range. And the way to really understand vitamin C is to go back to the writings of Irwin Stone, who wrote The Healing Factor, which was a fantastic book written in the 70s about vitamin C. And he points out that every creature, when they are sick, they greatly increase their liver or their kidneys' production of vitamin C. Now, humans, primates, and guinea pigs have lost that ability. We lack we still have the gene that makes the L-gluconolactone oxidase enzyme that converts glucose to vitamin C, but it's non-functional. So we have to get our vitamin C from the outside. We have to get it as food. But when we give it IV, in a sense, what we're doing is recreating the liver's ability to synthesize tremendous amounts of vitamin C. Now, I'm not sure how much humans can synthesize. I do know goats, when they are severely injured, can take what would be a normal synthesis of about 2,000 milligrams per day if you were comparing their weight to an adult human. It'd be about 2 grams a day when they're well, up to as high as 18 to 20 grams a day when they're sick, severely sick or injured or infected or stressed. And so I always look upon high-dose vitamin C as nature's way of dealing with crisis in terms of one's health. And so this notion, however, does not exist in the conventional thinking, in the medical mind. And my son, who's a second-year medical student, has had very little, if any, discussion of nutritional therapies. The only reason he knows he's had a little bit is because one of Dr. Reardon's students, Dr. Jeannie Driscoll, who is also doing IV vitamin C research, is at the University of Kansas, and there are more people aware of utilizing IV vitamin C for cancer there probably than any other medical school in the country. And so he has heard of it in his medical training, but other than that, there's no other nutritional training that he's gotten so far.
So it's just, I guess, this lack of appreciation that humans have lost the ability to make vitamin C, and if we had that ability, like many animals do, we would generate really high levels under certain conditions where we were exposed to these stressors that required and benefited from the vitamin C. So
right,
is that that's the primary reason? It's just this.
Well, and also, I mean, there are other factors involved here. There are financial factors. I mean, the standard oncology treatments are extremely expensive, and IV vitamin C, relatively speaking, is very inexpensive. And so the notion that something that is non-toxic and that has there's no FDA indication for IV vitamin C. So oncologists are reluctant to use what they consider to be a kind of a pop culture type of approach to cancer because, again, cancer is a life-threatening disease. But what they forget is that most cancer patients are depressed, they're in pain, they have tremendous fatigue and depression, and these are all signs of scurvy. And if you actually measure vitamin C levels in cancer patients, especially advanced cancer patients, they're all below that 0.6 milligrams per deciliter level that I was talking about. And so one of the things that IV vitamin C does is that it immediately relieves their scurvy symptoms. And so they start having a greater sense of well-being. Their pain, they don't need as much pain medicine. Their appetite improves. Their mood improves. They have a better quality of life. And this was recently replicated in a Japanese study that was reported on over in Japan at this symposium that I was at, that cancer patients who get IV vitamin C improve quality of life in all the various statistical measures that you can look at.
Okay, so it sounds like another component that really is somewhat obvious if you think about it is the economics of the situation too,
Right.
and that oral vitamin C is really inexpensive, but it's very few people are be able to go over 10 grams due to bowel tolerance issues, maybe 20 at the most. But so that's going to cost a few dollars. But even IV vitamin C is relatively inexpensive. I mean, when you consider the cost of the traditional oncology patient, and I don't see those patients, and you do, and you could perhaps give us a better idea. But my understanding is that we are talking hundreds of thousands of dollars in typically, I mean, many of these medications are tens of thousands of dollars a month to give to these patients, and that's a massive industry. So there's all these incentives to perpetuate that type of process or intervention, because there's massive amounts of profits to be made from people promoting that. Where
that's right.
No one's making money from vitamin C.
That's right.
That's sort of an option.
The way we're trying to position IV vitamin C is that it's an excellent adjunct, and Dr. Chen presented 2 weeks ago at our symposium, and she presented amazing research showing that in pancreatic cancer patients, if you give them just Gemzar alone, which is one of the standards of therapy there is a slight improvement, but nothing very dramatic. Vitamin C alone will show a significant improvement in pancreatic cancer cells in terms of knocking out tumor cells. But if you combine the two, vitamin C and Gemzar together, there is a clear synergistic benefit to the two together, as well as if they gave it to patients, which we know. We had a pancreatic cancer patient survive 2.5 years doing IV vitamin C, and the typical survival time of a standard pancreatic cancer is 3 to 6 months at best.
Probably 3.
3 is more typical if they're lucky. And so, plus the IV vitamin C greatly improves quality of life, reduces side effects from chemotherapy, and does not interfere with chemotherapeutic agents, even though that is a common misunderstanding. And that's another reason why oncologists do not normally recommend vitamin C, is they have this idea that the antioxidant effect of it's going to interfere with radiation or chemotherapy.
All right, I'd like to transition into more of the typical consumer questions that we have, because most of this is really more for professional. But on the other hand, between 1 in 2 and 1 in 3 people viewing this are going to be either themselves personally or know someone who has cancer. So it's not an insignificant question, and really understanding that this could be a very helpful therapeutic modality is important to know. So if someone has been inspired and curious to integrate this into either their own cancer program or someone they know or one of their family members, what would you suggest to them to do to acquire more information so they can implement this type of program?
Well, we actually have the Reardon IVC protocol on our website at reardonclinic.org, and so they could go there, and plus we've got all of our research articles on that same website, so they can start looking at the research. I've done a video on how vitamin C fights cancer at healthhunteronline.org that's very good.
And that's spelled just the way it sounds, Health Hunter?
healthhunteronline.org.
Okay.
And click on free video, and they can watch a very detailed explanation of how high-dose vitamin C has a pro-oxidant effect and can be very beneficial in treating the cancer patient.
Okay, great. Well, thank you for that, because I'm sure many people are going to be interested in integrating it.
And at that same website, Dr. Glenn Highland, who was an oncologist that's been consulting here at our clinic for several years, did a very nice lecture entitled IVC, Chemotherapy, and Radiation, Are They Compatible? And he does a compelling job of showing that not only are they compatible, but they are synergistic.
Great. Well, that's awesome. So thank you for compiling that and offering those resources. That will be very helpful. So I'd like to focus more to the oral version and what many people do, because it's probably one of the most common supplements that people are using is vitamin C. Now, as you alluded to, many times you're just simply unable to achieve the high levels in the blood that's necessary when you take oral. But there's a new version that I actually learned about first from Dr. Thomas Levy, who's clearly one of the leaders in this area, and that is liposomal vitamin C. And I wonder if you can address that, because his experience to me is that you tend to bypass many of the complications of the traditional vitamin C or ascorbic acid, and are able to achieve far higher intracellular concentrations that, in his case, seem to be comparable to the effects of intravenous vitamin C.
Yeah, I've talked to Tom about this at quite some length, and as of yet, I don't see the proof yet. I went ahead and got a case of liposomal vitamin C myself, and took my dose up to 34 grams a day using it. And one thing I can tell you is that it's amazingly well tolerated. But it does not raise the blood level all that much. And I've talked to Tom about this, and he says, well, it may not raise the blood level that much, but it does not require the GLUT transporter to get the vitamin C into the cell, so it just passes right on intracellularly. So I'm all in favor of people trying this, and I think it can be used as an adjunct to IV vitamin C, because most people are only going to do IV vitamin C once or twice a week.
Yes.
And so by doing the liposomal vitamin C, they can easily do 6 grams of liposomal vitamin C orally without a bit of gastrointestinal distress.
Yeah, it's interesting to hear your feedback on it. It's certainly more convenient, and not many of us are going to want to enjoy having a needle inserted into one of our veins twice a week. And the ascorbic acid can be relatively damaging to the veins. I mean, there's no question. So it's definitely.
No, that's not true. No, but that's not true.
I mean, irritating is what I meant to say.
I've given my wife over 350 IV vitamin C infusions because she had breast cancer about 12 years ago. And I've used the same vein for over 12 years without any difficulty. So you have to make sure that the company that you're getting your vitamin C from has properly buffered it. If ascorbic acid, if it was an acid type of substance, which it could be if they do not buffer it properly, then yes, you could get some damage to the endothelium of the veins.
Okay.
So,
well, just to finish up the discussion on liposomal, because I didn't really mention what that is for our viewers who have not been exposed to it before, but essentially it's something like an egg yolk where you have this phosphate bond that's attached to the vitamin C, and because of that, you get much better absorption. So that's why you tend not to see the diarrhea that you normally would, because it's not in the gut causing this osmotic diarrhea. So, that's one reason. But, the thought is that once attached to this phosphate, it just really goes straight from the blood into the cells. So that's why you may not see the higher blood values that you did seek to objectively document. But it's interesting to know, because you're clearly one of the leaders in the field. From your perspective, it's still somewhat unproven, but certainly not dangerous.
Oh, no, I would recommend it. There are other forms of vitamin C out there now that are they're new forms of sodium ascorbate that are buffered, that can be, I take 12 grams every day first thing in the morning, and I have no GI upset. So part of it too, you have to kind of get your gut in shape to vitamin C. And so not everyone needs to take that amount, but high doses of vitamin C does improve your immune system. It supports adrenal function. It's definitely can improve endorphin levels. So there's a lot of benefits to vitamin C just to general health.
Well, I wonder if you can comment now on some of the specifics of the oral forms that are available. There are a number of people, primarily with a naturopathic perspective, who believe that it's not just the pure vitamin C, the ascorbic acid, but it's a combination of the ascorbic acid with its associated micronutrients that one would find in nature, like the bioflavonoids and all the other components. And it's a synergy taken together that's more effective. Now,
there's no question that would be a better way to go. I mean, anytime you can do more like food, you're going to be better off. And I think people sometimes get the mistaken understanding that supplements are better than food. But I think food is still the essential thing that your body needs in order to get optimal cellular functioning. But when you're sick, you can use trace nutrients in orthomolecular doses to achieve effects that you can't get from just food alone. So, but in general, for people who are healthy, who are wanting to stay healthy, I would recommend using vitamin C that's got bioflavonoids and other cofactors